Hello everyone, thank you for joining me. My name is Monica and welcome to Module 3 of the Multimedia Caregiver Education Program for Fine Motor Skills. We will be discussing self-care skills, or also known as activities of daily living. We'll discuss utensil use, toothbrushing, dressing, and activity suggestions. So what are self-care or activities of daily living, also known as ADLs? Self-care tasks are the activities or occupations directed towards being able to take care of one's own body. These early activities are foundational to health and the expectations of living and being out in a social community and world. Self-care tasks are some of the earliest occupations or activities that children participate in. These include things like eating and feeding, bathing and showering, personal hygiene and grooming, dressing, toileting, and learning how to care for one's own body, and many more. At a young age, children are developing these self-care skills and habits as a shared activity with their parents or caregivers. Caregivers and parents are often the ones who establish early routines of dressing, feeding, and hygiene. Gaining the independence to participate in self-care tasks is important as children begin to mature and learn to carry these skills into social settings and out from the home and within community. Being able to be independent and care for themselves establishes their self-confidence and self-control. Foundations of self-care, or ADLs, begins as babies and progressively develops over time as children and adults. Many different factors such as culture, parent expectations, social and family routines, as well as the physical environment have influence on when and how children begin to carry out these self-care tasks. Now, through active participation in self-care tasks, children improve their body's function and health as we think about the strength, endurance, range of motion, and coordination that goes into activities such as pulling on pants or pushing a button through a jacket hole. Actively participating allows children to challenge the memory, sequencing, and ability to problem solve as they learn to develop independence and self-care tasks that are meaningful and purposeful. Being able to become successful at caring for oneself establishes confidence, self-esteem, and self-determination. These attributes are important to build as your children increases their autonomy or independence. As we know that self-care tasks are carried out almost daily, things like brushing your teeth every day, washing your hands after or before a meal, using the restroom. Completing these tasks helps to build routines or patterns which can lead to healthy habits for the future. Balanced routine supports a child in being able to meet the social and cultural expectations out in the community. For example, some families may require their child to use the restroom before they leave the house. And within the school setting, the children may be allowed to use the restroom at certain times, like during lunch break. As children grow and become more skilled, they are responsible for developing and maintaining healthy routines for their well-being. First up, we'll discuss utensil use for self-feeding. So when we talk about utensil use for feeding, our thoughts often turn to spoons and forks. These are important tools for eating food on the table. Infants start out gaining their nutrition from breastfeeding or bottles, then around 6 to 9 months, they progress to more solid finger foods. Then by 3 to 5 years old, they progress to the use of utensils independently for feeding themselves. Especially when we think about the importance of eating with utensils as we are in public and settings such as at lunches at school or inside of restaurants. Feeding utensils are dependent on the function as it relates to the hands, our food, and mouth. We adjust what utensil we use and how we use it depending on the food we eat. For example, when eating cereal or milk, we have to be really stable and coordinated to scoop and not spill all the milk on the spoon. Other foods like spaghetti would be easier using a fork. Much of learning as a young child is through self-initiated exploratory behaviors, which leads to the development of various skills and insights about objects and their surroundings. Starting out, infants show a variety of ways they use a spoon before there is an observed consistency in developing the appropriate grasp and more coordinated patterns of movements for eating. Using a spoon and fork involves many skills, such as having that core strength and maintaining control of our posture to keep our bodies upright, so that we are able to move the arms in a coordinated manner. It also requires development of appropriate grasp and the eye-hand coordination for picking up our food on the plate and the body awareness of bringing it to our mouth. There are many ways to support the success of utensil use in developing children. In the earliest stages of using spoons, the natural starting point for infants to learn about the function of a spoon is through play. When first given a spoon, children have been observed to do whatever may come to mind while playing with it, rather than having the goal of feeding themselves. Creating a safe space for exploration provides opportunities for learning. Babies have been observed to mouth the utensil. This helps with understanding the shape of the spoon and developing awareness of the mouth as they feel the spoon on their teeth, tongue, gums, and cheeks. Babies will wrap their fingers around the utensils, bang two spoons against each other, or tap on the surface of a table. You may also see them shake, drop, or throw a spoon. They then begin exploring food by poking at it, moving food bits from place to place on the table before finally bringing it to their mouth. In young babies, they will explore utensils by running their fingers over spoons and forks and passing it between their hands, and over time beginning to direct it at surfaces and foods presented to them. Studies have shown that actively setting up and organizing the environment supports and encourages babies' learning, creating a safe space for children to engage in with a spoon during mealtime. For example, in the study, the parent moved dangerous objects out of reach and kept a bowl steady whenever the baby was reaching for it. Parents also provide babies with objects such as an empty dish and utensil to play with. Continuously providing these opportunities and interactions over time give babies the chance to increase their knowledge and discover the functionality of a utensil. Now, when we think about success with eating and using utensils, we have to discuss proximal stability and proper seating. This means having that core strength to keep our body and head upright so that we are not slouched over. Think about when you're eating. If you're leaning all the way forward or leaning too far back, it takes more work and energy to eat. Providing proper seating so that your child is supported their hips and feet provides stabilization and less demand on the body to remain upright. We also think about how we sit, keeping our body and head up and aligned with what is in front of us. This good orientation will provide a clear visual field that lets us see our meal and where both of our hands are so we can adjust and plan our movements to eat, such as when one hand stabilizes the bowl and the other can scoop and bring to our mouth. As mentioned, providing utensils for babies to play with supports learning and manual exploration with their hands, as they develop their own perception and functionality of the utensils. As they explore utensils during mealtime, they are feeling the hardness of the utensil, a groove in a spoon, and recognizing it's easier to hold the handle of a spoon rather than the base. Visually, they explore the different dimensions as they flip it over or upside down, and learning to recognize it's still a spoon, regardless of how it's turned. As they get given more opportunities to develop their skills during mealtime with food, it facilitates increased independence. Improving their ability to self-feed with utensils is important because it allows children the autonomy to control the pace or speed at which they're eating and understand the amount of food they're taking in and determining when they're still hungry or full. Eating is an everyday activity occurring multiple times throughout the day. Developing these necessary skills to be able to self-feed is integral to the health and wellness of a child and leads to the development of their self-determination. Now here is what you may see for a self-feeding progression. From 6 to 9 months, they'll begin to want to help to feed themselves. From 9 to 13 months, they begin to finger feed soft foods and foods that melt quickly. At around 12 to 14 months, they may dip their spoon in food. From 15 to 18 months, they will scoop food with a spoon and feed themselves. And from 18 to 24, they may use a spoon without spilling. And then from about 3 to 5 years, they will be eating by themselves. Now, some activity suggestions includes a scoop and pick up marshmallow. This can be a fun no-mess play activity to practice utensil use. You can place cotton balls in a bowl and demonstrate a spoon grasp or include tongs to pick up the cotton balls to strengthen the hand muscles and grasp and release. Another activity is pretend play by using Play-Doh to make fruits and veggies and put a popsicle stick through it. This play activity works on finger and grasping to poke foods with forks. Some activities for growing kids to expand their skills and grow independence include continuing to pretend play with Play-Doh and allowing your child to become involved in food preparation. They could be mixing or stirring during cooking, learning to pour out their own drinks, or picking out proper utensils for the meals. Next up, we'll be discussing toothbrushing. Now let's talk about toothbrushing. Like self-feeding, brushing our teeth is another priority task that we engage in every day. It's vital to discuss and teach children the importance of brushing their teeth regularly and at least twice a day because it's the most effective form of prevention from cavities. According to the Centers for Disease Control and Prevention, cavities, or also known as dental caries or tooth decay, are one of the most common and chronic or recurring diseases of childhood in the United States. Globally, cavities is one of the most prevalent diseases, and a 2015 research study estimated about 621 million children around the world have untreated cavities. Cavities and poor oral hygiene has a profound impact on the health and wellness of children. Brushing our teeth at least twice a day is low cost and effective at controlling plaque, which is a film of bacteria that attaches to our teeth after eating. Admittedly, toothbrushing can be a challenge for many parents and caregivers of children. Brushing our teeth often takes place at the busiest times. For family life, parents share that eating breakfast, preparing to leave the house for school, or getting into bed to sleep are prioritized activities. Reports from parents share they often observe behaviors in their child such as crying, running away, biting the toothbrushes, refusing to open their mouth, or not keeping still during toothbrushing. A study at a special child care center revealed that about 40% of children were afraid of toothbrushing, and about half of the children did not understand the importance of brushing their teeth daily. So, what are some strategies to support oral health success? This can include sensory motor exposure, thinking about the finger and hand strength involved to grip the toothbrush, coordinating movements and dexterity to bring the wrist in different directions, or the sensory aspect of involving the feeling of the bristles on the brush, having that oral awareness of where our teeth are, and feeling and understanding where to place the brush head. Additional strategies include video modeling and social stories to help children to sequence, understand the steps, plan movements, and learn the importance of brushing their teeth, like this book on the right with Elmo, Ready, Set, Brush. Studies have also revealed that children learn and change through play. One such study showed a toothbrushing game can help children improve their effectiveness at cleaning their teeth, increase the number of their brushing strokes, and a longer brushing time. A children's ability to care for themselves can be improved when they are started early on and allowed to be an active participant and develop understanding of the task. Supporting child success with toothbrushing supports their overall independence in caring for the health and reduces the strain on parents and caregivers. So beginning to brush your baby's teeth as soon as their first tooth emerges has many benefits as babies grow to tolerate it, and the initiation into toothbrushing helps to set a foundation for engagement in self-care tasks and promotes the formation of the healthy habit early on. Toothbrushing is a focus for many families and something to discuss with doctors and dentists because it is a health-promoting intervention and prevention from cavities. In an international study, parents who started brushing their children's teeth before the age of 2 was found to be strongly associated with children not having any cavities by the age of 4 years old. As mentioned earlier, cavities is one of the most commonly occurring diseases among children, with it occurring most often at 6 years of age. Studies in the CDC have reported many related consequences to improper toothbrushing or lack of toothbrushing habits that lead to cavities. When left untreated, cavities can cause pain or infections in children. They may also cause of loss of sleep, problems with eating and speaking, and some studies report poor oral health can affect a child's learning, as pain and frequent dental appointments may cause them to miss more school days and subsequently receive grades lower than children without them. Another study reveals that children who start a toothbrushing habit before the age of 1 and brush their teeth regularly were found to be able to practice more steps than children who started to brush their teeth after 12 months and did not establish a toothbrushing habit. A child's performance in toothbrushing is of importance because it builds the foundation for future health-promoting activities. Now, the CDC has provided recommended guidelines to support oral health in children. Here are some things that parents and caregivers can do. For babies, you can wipe their gums twice a day with good, clean, soft cloth after their first time eating and right before bed. When their teeth appears, you can also begin brushing twice a day with a soft, small toothbrush and water. As they grow older, start the habit of brushing their teeth twice a day with a fluoride toothpaste. Support your child until they have good toothbrushing skills by supervising them. Now, the first activity that can support your child's toothbrushing skills is a play activity to help your child become familiar with brushing their teeth. Pretend play. During playtime, bring a clean toothbrush and allow your child to brush their favorite toy's teeth. Even if there isn't mouth or visual teeth, do a morning and nighttime routine for the toys. This will help to create more familiarity with the sequencing and risk control and stability. It also helps to create a fun, positive association with brushing their teeth. The next activity includes using an ice cube tray and pretend play for each of their teeth. So things like flipping the ice cube tray facing down, using a marker to draw some shapes to pretend it's food stuck to the teeth, and having their child dip the toothbrush in water and demonstrate movements back and forth, applying enough pressure to remove the food and allow them to sequence that teach their child to clean. Next up, we have flossing. Pretend play with flossing. So again, you can use an ice cube tray and flip it upside down. Grab some Play-Doh and push it between the space of the teeth to demonstrate the food stuck. Using yarn or pipe cleaners, demonstrate for your child how to grab each end with both their hands and push down and lift to pull out the food. These are all fun play activities that supports a positive relationship for your child with toothbrushing. Lastly, we have dressing and fine motor. So moving on to the final topic of our module, dressing is the process of taking off and putting on our clothes. So many steps engage our fine motor function. Things like pulling on our socks, buttoning a shirt, gripping the pants to bring up over our legs, and zipping the jacket up to keep warm. For typical children, it takes at least 4 years of practicing in order to become independent in dressing themselves. Let's think about ourselves. Routinely every day, we get dressed for some occasion. It could be pants and a shirt for work, staying cozy in some button pajamas, or dressing up to go to celebrate a special event. Being able to get ourselves dressed is important in participating in our daily lives. When a child is able to dress on their own, it not only helps relieve the one-on-one assistance from parents and caregivers, it supports their self-esteem and being able to choose their own clothing and determination in completing their self-care tasks. So dressing is unique and requires many different senses and skills to occur all at once in order to complete properly. Gross motor skills such as having a strong core and postural control is important to being able to balance and shift our weight as we navigate putting our arms through a shirt or putting our feet one by one through pant holes. Dressing also challenges our ability to process such as being able to choose appropriate clothing, like a shirt for our upper body and pants for the lower. It requires us to remember the sequence and steps, such as putting on our pants, then a belt, or the ability to motor plant as we shift our weight and put one leg and allow the other to stay on the ground to keep us balanced. As we hone in on fine motor skills, there are many we have previously discussed that go into dressing. These skills may be requiring the string to grasp onto the hems of our shirt and yanking it over our heads, or the ability to pull a jacket on and wiggle our feet into a pair of socks. It requires eye-hand coordination. Children will need to use their visual senses and body awareness in order to know where their bodies are in space so that they can reach for a clothing item and guide their arms and legs through. Being able to use both sides of the body, known as bilateral coordination, to smoothly carry out dressing tasks such as tying shoelaces or buttoning a shirt. Development of the thumb web space and arches within the hand also provide the dexterity to fingers so that they can manipulate small objects with ease. Now, like with utensil use and toothbrushing, developing personal care skills sets a child up for success by allowing them to function on their own in many settings and reduces the child's need for support in the future. Increased exposure and setting up opportunities for your child to learn to dress themselves provides them with a chance to practice different sizes and types of clothing, which contributes to a foundation for successfully transitioning into adulthood. Developing independence in dressing and being able to adapt to perform this self-care task in a variety of settings that are familiar and unfamiliar, such as putting on pajamas at home, a coat in the school, or trying on new clothes at the store. Success in self-care skills is important for being out in the community, socializing with their peers, future employment, and accessing resources within the community. Now here is an example of progression of dressing skills. So at around 1 year, children may remove their socks or put on and take off a loose-fitting hat. At around 2, they begin to remove their shoes. At around 2.5, they may attempt to put on socks or unbutton a large button. At around 3 years of age, they put on a t-shirt with little help. They put on their socks with little help and some shoes as well. At around 3.5 years, some skills you may see would include unzipping a jacket, buttoning 3 or 4 buttons. At around 4 years, you may see them lace their shoelaces together and place socks on with the appropriate orientation. And finally, around 5 years old, you may see them dress independently, all on their own. Now, some activities for dressing can include a button and zip snake, or a button ribbon. This is a fun visual motor activity to practice buttoning skills for dressing. You can cut a long strand of ribbon and sew a button onto each end. Cutting different shapes or squares of the fabric, like a heart or triangle, creates a fun learning experience. By marking a line at the center and creating a small stip to create an opening big enough for a button to pass through. This activity will allow your child to practice grasping the button, pushing through the opening, and pulling the fabric over. This next activity is to push and find coins. This works on finger strengthening and grasp for buttoning with small items through a Play-Doh activity. You can gather some loose change, roll a section of Play-Doh into a log or snake shape, and practice holding the coin and pushing into the Play-Doh. This promotes finger isolation and strengthening, eye-hand coordination, sensory exploration, and problem solving. And that concludes our third module. Thank you so much for joining us, and we hope this was exciting and helpful to learn. I look forward to sharing more with you. Thank you.